Hi guys, so my latest book launch is the Acne Care Bible, and it's now up on Amazon Kindle, Apple Books, and Barnes& Noble. I'm going to be starting a series of mini masterclasses highlighting important chapters in this book. An example we're going to start with today is a fascinating but little known subtype of acne. It is known as acne excoriae. The origins of this term actually come from the French language. It is known as acne excoriae des jeunes filles, which refers to the excoriations in young adolescent girls. Acne excoriae is actually quite classical of a condition in the realm of psychodermatology. Psychodermatology essentially is the overlap of psychiatry and dermatology, primarily because there are several connections between the skin and brain. The classical presentation of acne excoriae looks a lot like regular acne, except that you find there are a lot more excoriations and wounds which an experienced dermatologist would be able to pick up. The fascinating thing about acne excoriae is that the underlying acne condition very often isn't that severe, but the condition looks rather serious simply because of this never-ending cycle where the sufferer is compelled to pick and excoriate their skin, and this leads to secondary infections as well as scarring in the form of post-inflammation hyperpigmentation and deeper acne scars. This condition, if treated like regular acne, will not respond. It is thus important that your dermatologist picks this up. Have you heard of blind pimples? Well, I've been asked several times in the past about treatment for blind pimples, as if it were a special mysterious category of acne. Blind pimples refer to the layperson's interpretation of closed comedones, as opposed to open comedones, which are visible blackheads. Closed comedones, otherwise known as whiteheads, appear to not have a connection to the surface of the skin. As a result, one may feel that these blind pimples actually need some assistance in order to extrude its contents. Well, nothing could be further from the truth. And in this case, trying to extrude the contents of a blind pimple is often what leads to inflammation, causing the blind pimple to become an inflamed papule, or even worse, a cyst. Essentially, all acne is treated similarly from a dermatologist's point of view. Whiteheads, blackheads, papules, and cysts, these are all manifestations of inflammation in a genetically predisposed individual. The key here is actually to stop inflammation. Very often, if the acne is moderate or severe in nature, oral medications may be required to reduce inflammation. Superficial external methods include application of pimple creams that hopefully can reduce the swelling and inflammation, reduce scarring and pigmentation. In terms of the pathophysiology of comedones, it's also interesting to note that there is follicular hyperkeratosis, which means that there is retention of dead skin cells around the hair follicles on the face. That is significant because it can be treated with chemical peels and microdermabrasion. What are some of the traditional topical acne treatments? Well, you may have heard of tea tree oil, salicylic acid, sulfur, and even calamine lotion. Many of these are used in over-the-counter pharmacy preparations for treatment of mild acne. These are very rarely used, if ever, now in dermatology practices because of its limited efficacy. In terms of active ingredients that are commonly used to treat acne, benzoyl peroxide, as well as adapalene or retinoid alternatives are often prescribed. These, however, can cause skin irritation, also known as irritant contact dermatitis, especially when you're living in a very sunny climate like Singapore, because of its tendency to make your skin rather photosensitive. In my practice, we focus a lot on emerging botanicals, which have some evidence in terms of its ability to treat various pathophysiological processes behind acne itself. An example is berberine. Berberine is actually a favorite traditional Chinese medication herb, which in the last 5 years has been published in mainstream peer-reviewed dermatology journals for its unique ability to address several pathways in acne pathophysiology, including being able to target hyperpigmentation and scarring on top of its anti-inflammatory effects. It's also able to inhibit the growth of Propionibacterium acnes, a key bacteria found on the skin of sufferers of acne. Chlorella vulgaris, which is found in the blemish spot cream, is another active ingredient that has demonstrated some potential to inhibit oil production as well as exhibit anti-inflammatory properties when applied to pimples.